A 13-year-old boy is brought to the clinic by his mother, complaining that her son has been more tired than usual over the past 5 days. She denies any recent hospitalization but reports that he was recently diagnosed with the flu. She also complains that he has been eating a lot more than usual but has been losing weight. She reports that he has been drinking more fluid than usual, urinating more than usual, and this morning, while she was talking to him, his breath smelled fruity, like an overripe fruit. In today's video, I'll continue to discuss diabetes, but this time around focusing specifically on type 1 diabetes. As I discussed in the previous video, diabetes mellitus is a metabolic disease characterized by chronic high sugar in the blood known as hyperglycemia. I also talked about the role of the pancreas in regards to regulating blood sugar levels. The pancreas produces a hormone known as insulin, and the role of insulin is to help the body's cells take up the glucose, which is the sugar produced by the breakdown of food. In the previous video, I also used the analogy of members of an organization losing the room key to get into a room building, and how that led to the members piling up in the building hallway, unable to get into the building room. The building hallway in the analogy represented the blood vessel. The members of the organization represented the blood sugar. The building room where the workers were trying to get into represented the cells of the body that required the glucose, and insulin acts as the key that's required to open the door to let the sugar into these cells. In type 1 diabetes, the part of the pancreas responsible for producing insulin is no longer functional. This is an autoimmune problem typically caused by the presence of autoantibodies, resulting in the body's own immune system attacking and destroying the part of the pancreas responsible for producing insulin. This results in very little or an absolute lack of production of insulin, which is different from type 2 diabetes, whereby you only have a decrease in the amount of insulin produced. Because of the absolute lack of production of insulin in type 1 diabetes, this results in a worse condition compared to type 2. Therefore, patients are typically sicker on initial presentation to the hospital. Type 1 diabetes also does not have a strong genetic association as compared to type 2, and type 1 diabetes also typically develops during adolescence, unlike type 2 diabetes, which typically develops later on during adulthood. In regards to prevalence, type 1 diabetes has a much lower prevalence compared to type 2. Some studies suggest an estimated amount of 8.4 million people worldwide suffer from type 1 diabetes. In 2017, the International Diabetes Federation reported an estimated amount of 50,600 children and adolescents below the age of 20 were living with type 1 diabetes in Africa. However, this number could be an underrepresentation of the true prevalence of type 1 diabetes in the continent. It stands out as an almost neglected disease in the continent, receiving very little scientific attention and funding for research, potentially underestimating the true prevalence estimates. At the start of the video, I talked about a 13-year-old boy brought to the clinic by his mother complaining that her son has been more tired than usual, losing weight despite eating more than usual, drinking excess fluid, urinating more than usual, and having a fruity breath. This kid has a lot of symptoms of type 1 diabetes, which include fatigue, polyuria, polydipsia, polyphagia, weight loss, and visual disturbance. In regards to complication, type 1 diabetes shares the same potential complications as type 2 diabetes, but the most dangerous immediate complication associated with type 1 diabetes is a condition known as Diabetic KetoAcidosis, also known simply as DKA. DKA occurs when the body reverts to another process of energy production known as ketoacidosis. Diabetes, as I explained earlier, is a process whereby blood sugar is not able to enter the body's cells, including your brain cells. In type 1 diabetes, because there is little to no production of insulin, which is the key required to open the body's cells to let the sugar in, the body and the brain sense this as that the body is starving, which is why one of the symptoms of type 1 diabetes discussed earlier is weight loss despite hunger and polyphagia. So the brain then tells the body to start breaking down other sources of energy, such as the body's fat, since there is no sugar available. The breakdown of fat is known as ketoacidosis, and a byproduct of this breakdown is an acid known as ketones. These ketones are what results in the fruity breath. This is a very dangerous condition and can be fatal without adequate treatment and intervention. The process of DKA can be triggered by poor treatment adherence to insulin, as well as an increase in the body's insulin demand, such as during times of acute illness, surgery, or stress. Symptoms of DKA to keep an eye out for include the other symptoms of type 1 diabetes, as well as the following: fruity breath, nausea, vomiting, shortness of breath, abdominal pain, rapid breathing with long deep breaths, and this is known as Kussmaul respiration, as well as neurological abnormalities such as altered mental status, confusion, and possible coma. Other signs of DKA include signs of dehydration such as dry mouth and decreased skin turgor. Treatments for DKA typically involve insulin, IV fluids, and electrolyte replacement, especially potassium. Management of type 1 diabetes typically involves insulin therapy and adequate adherence to the therapy, especially during times of increased insulin demand. So in summary, type 1 diabetes is similar to type 2 diabetes in that they both involve high blood sugar levels, but type 1 diabetes is caused by the body's immune system attacking and destroying the part of the pancreas that's responsible for producing insulin, and this results in little to no production of insulin. Type 1 diabetes is also less prevalent than type 2 diabetes and is more common in adolescents and a younger population compared to type 2. The symptoms of type 1 diabetes are similar to that of type 2, but type 1 diabetes can present with a potentially fatal complication known as diabetic ketoacidosis, which typically presents with symptoms such as polyuria, polyphagia, weight loss, fatigue, nausea, vomiting, abdominal pain, fruity breath, and potentially neurological compromise such as altered mental status, confusion, and coma. Thank you for taking the time to watch today's video. Please do leave a like, comment, and subscribe in order to catch more of the content in the future. Hope you have a great day. Bye.